Good afternoon, I'm Sean Yao and this is One News Now. Malacanang insists that the Philippines is not back to square one despite reporting record-high daily jumps in COVID-19 cases in the past few days. Maricel Halili joins us live from Mandaluyong City to tell us more. Mase, does this mean that a region-wide ECQ is still off the table at the moment?
Yes, that's right, Sean. Presidential spokesperson Harry Roque explained during his press briefing earlier that for now, there is no room for another declaration of enhanced community quarantine, particularly here in Metro Manila, because they see that the localized lockdown is already effective and enough to control the increase of number of COVID-19. So they are planning to continue implementing localized lockdown instead of nationwide ECQ.
All right, Mase, I know this is a difficult question to answer, but does the palace have any idea what is causing the uptick in cases according to Harry Roque? Did he have anything to say? Do they have any educated guesses?
If we base it on the statement of, well, not Secretary Roque per se, but of Health Secretary Francisco Duque, he mentioned that the possible cause of the surge of COVID-19 cases nowadays is the increase in mobility. Since the national government has decided to open the economy, of course, people are encouraged to go out so that the businesses will get some income. And because of the increased mobility, they see that this is one of the reasons why there is also an increase on COVID cases.
All right, and was there any update also on the country's healthcare utilization rate? We've, of course, getting a lot of messages on our phones and on social media also about hospitals reaching capacity for COVID wards.
I'm not sure if I get your question right. It's quite noisy here in our place, Sean. But if I understand you correctly, you're asking about the hospital utilization. Well, the national government confirms that there is an increase on the hospital utilization, especially now that there's a surge on COVID cases. But Vaccine Czar, Carlito Galvez, explained earlier that they have asked those officers in charge, particularly Under Secretary Vega of the Department of Health, to check the hospitals. What are the situation in COVID hospitals? They feel that one of the reasons why the utilization rate in the hospitals increased now is because during the dull moments, they accommodated non-COVID patients. So the 20% bed capacity allotted for COVID patients were used by non-COVID patients. So they have to address this issue to make sure that we have enough available bed capacity for COVID patients.
Right, so mostly logistic issues, at least for now. Speaking of vaccines, Carlito Galvez Jr., he did announce that we've signed a supply agreement with the Serum Institute of India for Novavax vaccines. How many doses are we talking about, and when can we expect Novavax to arrive on our shores?
We're talking about 30 million doses of Novavax. Well, like you said, Secretary Galvez just arrived from India. He is now in quarantine after his visit in India. They have signed a supply agreement with the SII of India to ensure the 30 million doses of Novavax. The national government is expecting these doses of vaccines to be delivered sometime in third or fourth quarter of this year.
And of course, we know that what we have right now here in the Philippines is Astrazeneca and Sinovac. How many additional doses can we look forward to from these two suppliers? And as usual, when are the target arrival dates?
the national government is expecting about 2.3 million doses of vaccines before the end of this month or probably early next month. Secretary Galvez said that we're expecting about 1.4 million doses of Sinovac probably this month, sometime in March 22, 23, or 24. And probably around almost 1 million doses of Astrazeneca from the COVAX facility as promised by the World Health Organization. Some of these are donated by the COVAX, and of course some of the doses of Sinovac are donated by the Chinese government, and some of those are purchased by the national government.
All right, when it comes to AstraZeneca, Mase, we've heard Germany, Italy, and France temporarily suspending the use of AstraZeneca in their countries in the European Union. Is the government here also considering suspending or halting the rollout of AstraZeneca due to the reports of blood clot formation among some recipients? Of course, the WHO said it should still be okay and it is still safe. So what is it really?
Of course, this is a cause of concern for some sectors following the reports of a possible blood clot as an adverse effect of AstraZeneca. But Secretary Roque explained that for now, we are not planning to suspend the vaccination or the usage of AstraZeneca because like what Dr. Bravo has said, Dr. Lulu Bravo is the head of the group monitoring the adverse effect of the vaccines. So as quoting Dr. Lulu Bravo, Secretary Roque said that we don't have enough data to prove that AstraZeneca is causing blood clot to patients. So we still have to have this kind of data as a basis whether to suspend or continue the vaccination or the usage of AstraZeneca. But for now, the national government is planning to continue its usage, particularly to healthcare workers.
So still all systems go for AstraZeneca. Now did spokesman Roque clarify the president's order to immediately vaccinate the poor? What does this mean? It's very vague. Was there any clarification by the spokesman?
You're right, Sean. If we base it on the statement of President Duterte last night, he did mention that he wants to prioritize the poorest of the poor. But then, during the press briefing of Secretary Roque, he presented a priority list drafted by the IATF as recommended by NITAG, of course. And based on this priority list, the top priorities is still the healthcare workers, to be followed by the senior citizens. Third are those individuals who are suffering from comorbidities, followed by the uniformed personnel. And the fifth are those included in the poorest of the poor, the beneficiaries of the Pantawid Pamilya Pilipino program. So this priority list will remain, and they will still follow this as the vaccination program continues.
All right, that's good to hear. Now, moving on to another pandemic, any update on the proposal to declare a state of emergency because of the threat of the African swine fever?
We also asked that to Secretary Roque during his press briefing earlier, but so far, Malacanang is still waiting for the recommendation of the Department of Agriculture. They are drafting the content of the state of emergency should there be a need to declare. And then once Malacanang receive the draft or the recommendation coming from the Agriculture Department, then the President will decide whether to declare a state of emergency due to the African swine fever.
All right, so still pending that draft from the DA. Thank you so much for all those updates. Maricel Halili joining us live from Mandaluyong. One doctor is recommending to reduce passenger capacity in public transportation to 30% or less in order to curb the spike in COVID-19 cases. In an interview with One News's The Chiefs, Philippine College of Physicians Vice President Maricar Limpin said this will ensure that physical distancing will still be followed. Limpin also suggested a uniform RT-PCR testing travel requirement in all provinces to limit movement.
Siguro kung kailangan gawin, lahat na lang, yun gawin na lang na mag-require lahat ng RT-PCR. Kasi pag po ang mga tao pupunta from province to Metro Manila, no restrictions at all. Isa sa magandang pamamaraan is make standard intervention na ia-apply sa lahat ng local government units. Para sa ganon, hindi nalilito ang mga tao.
Let's check in on other COVID-19 stories from around the world. Moderna has begun testing a COVID-19 vaccine that will be shipped to refrigerators or shipped in refrigerators instead of freezers with extremely low temperatures. The U.S. pharmaceutical company said this could make distribution easier, especially in developing nations with supply chain issues. The World Health Organization is appealing to countries not to pause vaccination drives due to safety fears on Astrazeneca shots. The organization says there's no proof yet that side effects, such as blood clotting, are directly linked to the vaccine. And Facebook has started labeling posts that discuss vaccine in an expanded effort to combat COVID-19 misinformation. The tech giant says these labels should contain credible information about the shots from official sources across the globe. Bus and jeepney operators once again opposed the government's push for the PUV modernization program amid the pandemic. Mean Los Baños joins us live from Mandaluyong for more details. Hi, Mean. How did the Senate hearing on this issue go?
Hi, good afternoon, Sean. The LTFRB was once again at the receiving end of complaints from jeepney and bus drivers and operators for its modernization program. The LTFRB, however, insists many still support the program. In today's Senate hearing, LTFRB Chairman Martin Delgra III reported that almost 3,000 units have been modernized as of this month amid the pandemic. But PUV groups were quick to complain about this. Danilo Yumol of the Confederation of Drivers and Operators in Central Luzon insisted they can't afford to modernize since Class 1 units amount to 1 million pesos. Class 2 units would need more than 2 million pesos to be modernized, while Class 3 is close to 3 million pesos. Jeepney operators and drivers have a similar complaint since the modernization will cost them about 40,000 pesos a month. This is almost impossible to reach given their 300 peso earnings daily. Jeepney Operators Group Piston also blasted the LTFRB for seemingly pushing them to consolidate and be part of cooperatives, when this would mean they will lose their individual franchise. The group also claimed the agency is only accepting applications from huge corporations and businessmen who will run a transport business. In reply, the LTFRB explained they only want drivers and operators to consolidate to help them in their bank loans. Consolidation would also mean a fixed salary for drivers instead of relying on boundary system. Delgra also clarified that jeeps can still operate in their routes and with their individual franchise even if they get past the March 31 deadline without consolidation. Sean, Senator Grace Poe noted that even with DOTR's implementation of modernization program, it is clear in the Bayanihan 1 law that the traditional jeepneys should not be phased out, especially during this pandemic. Sean?
All right, we'll wait for more updates on this story. Thank you so much, Mean Los Baños from Mandaluyong City. The Toll Regulatory Board has clarified that the Skyway Stage 3 will remain open for all motorists. In an interview with Radyo 5, TRB spokesperson Julius Corpus denied sending a directive to San Miguel Corporation. The operator earlier announced that the highway will be closed indefinitely starting today, as ordered by the TRB.
This came as a surprise, sapagkat personally wala po akong alam na kautusan na binigay ng Toll Regulatory Board management, particularly headed by our OIC Executive Director Asek Giovanni P. Lopez, na ipasara itong ating Skyway Stage 3.
For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.